Welcome, folks. We're going to give everybody a few minutes to get in, and you are going to be automatically muted with your cameras off. If you would like to ask a question of Marcia, feel free to type it into the chat. Alyssa is going to help us out and pull questions from the chat if they're relevant to what we're talking about, and we can try and answer them in real time. Otherwise, we'll try and save a few minutes at the end for any specific questions. But welcome everyone to this Q&A with Marcia Stickel. Marcia Stickel is a registered nurse, and she is the retired director of the Wellness Inclusion Nursing Program through Waisman Center. So she's worked with people with disabilities around community nursing for approximately 3,000 years, Marcia, something like that. And she's also currently on the State Disaster Medical Advisory Committee. And so that committee is the group that's providing recommendations to the state around vaccination rollout and all things COVID related. So thank you very much, Marcia, for agreeing to come back and do a Q&A with us today. I know people are trying to figure out a lot of new information that's coming in really fast, and we always really appreciate your expertise. So thank you for being here.
Glad to be here. I'm very excited about the positives. A lot of positives. I don't remember when the last time we did a Q&A.
It was winter, definitely.
Yeah,
winter.
I was thinking might have been January. But we truly do have an organized system from the president down now. And I just saw today that the statistics show that in the past week, there's been 2 million doses of vaccine given daily. So that is a huge increase. This is nationwide, and well above and beyond what Biden had promised in his first 100 days. So the good news is we have now 3 vaccines and a very, very huge increase in amount of vaccine that's being produced. So, but how do you get a shot? That's probably the very first thing we want to start with. And I wanted to mention the increase in doses available because I wanted you to be hopeful. Most of you may have seen, Stephanie, seen the phase 1B document?
Yes, yeah,
Okay.
That's been shared.
Okay, so you know that in priority order, the first on the list are educators. And then next on the list are people in MA long-term care, which is probably including most of the people that are listening or watching here. What we are finding is there is a big push, and again, that has become a national push for all educators everywhere in the US to get vaccinated so the schools open up. And I do agree that is a very big issue. However, I know that for people who are in this second group, they may feel frustrated. So I want to encourage you that a lot of vaccine is going to educators right now, but there very well may be open spots now for people who fit in the MA long-term care group. And I have found that people have gotten on wait lists at pharmacies. They've communicated with their doctors through my chart or whatever way, usually it would be my chart, and asked about it. Savvy doctors understand about the list, but not all. A lot of doctors don't, they're not paying any attention. So you may have to bring it to their attention. You may have to attach the document from the state that includes you or your loved one. you may have to provide a written letter or some sort of information that explains that you are part of an MA long-term care program. So I see here we have these steps written up that pretty much tells how to do it as far as through public health and through Walgreens, and also that now includes Kroger and Pick and Save. So you can check on those. And then the Wisconsin State Registry, which is the last one, just opened up yesterday. A few providers are on there: Rock County, La Crosse County, and Greene County, you said. So it's a work in progress. The goal, the hope is that it's going to be much more widely available as far as providers, and that you can go through the process there to get registered.
Mm-hmm. And Marcia, let's pause here and go through, Lauren's going to take us through the survey for Dane County residents or folks who want to get vaccinated here in Dane County.
Good.
A couple of steps. So Lauren, if you do a screen share, and I'll talk through. So this is what the vaccine sign up for looks like that we just linked in the chat. This is for Dane County. Although if you are willing to drive to Dane County to get vaccinated, it is open to you as well. So first you'll select a language. We'll go through it in English. And then you're going to identify yourself as an individual. And then this is the part that might be a little confusing. If you're registering for a person with that's in Iris or family care that is younger than 65 and isn't any of those other things, you're going to click none of the above. That doesn't mean that you're not eligible. So then you come into this category.
That's really important, that people don't get discouraged when they see that. Right. Okay.
Right. So come down to this next question where you'll select individual enrolled in Medicaid long-term care program. And then it's going to pop up with all this information about your name, your contact information, if you do or don't have an email address, date of birth, ethnicity. It's also down here going to ask about your healthcare provider. That I'm assuming is, in some cases, they may bill. The vaccine itself is free, but they may bill a small administrative fee to your healthcare provider for giving you the vaccine at the mass vaccination sites. And then you click yes, and you'll go ahead and submit the form. So once you get those first couple of questions out of the way, it's pretty straightforward, but just wanted to make sure that everybody could see how that registration worked.
Yes.
And this would be signing up to get vaccinated at the site that's at Alliant Energy Center in Madison. So that's just off the Beltline at John Nolan. So thanks, Lauren.
And I want to encourage, I think it was still on there today, that anybody that's wondering how that works at the Alliant Center, there's a video that's on the website, and so at the Madison-Dane County website, it will walk you through or drive you through having the vaccination done there. And I think that's kind of nice because people wonder, they're familiar maybe with going into a clinic, but how does that work at a place like the Alliance Center? And it's basically, you're in your car and you do your contact through your phone, and then you actually drive up and get your vaccination, your shot, while you're in the car. Then you go and park for 15 minutes because that is the standard in case you should have a life-threatening allergic response, which is very, very rare, but they are being careful. And you're supposed to flash your lights and honk your horn if you have that kind of a response. And it would be 30 minutes if you were someone who has had anaphylaxis, is what it's called, but that's the emergency allergic response where it affects your breathing. The statistics are that, like Pfizer, 4.7 people in a million have had that kind of a response. And for Moderna, it's been 2.5 people in a million. And as far as the Johnson & Johnson, so far, only one person. Of course, Johnson & Johnson has been around as far as the US for not a very long time. So, so it's not likely you're going to have anaphylaxis, but it is always they do the same thing for people when you have your flu shot. They have you wait 15 minutes. So it's a standard safe kind of thing to do.
Yeah, yeah. Thanks, Marcia, for that information. I think just to kind of close out the sign up process, one thing I will say is, having talked to families who have been able to get their loved ones signed up to get a vaccination, what seems to work best is signing up on multiple of these sites if you have capacity to do so. If internet is a problem for you or anyone you know, the state has also just announced a hotline phone number that anyone in the state can call to receive assistance with vaccination questions, including assistance to get signed up. And so we're going to post that in the chat. Thank you, Lauren. So that's a toll-free number. And please do share that with particularly people who don't have access to the internet or who aren't maybe as internet savvy. This is obviously incredibly complicated. Getting signed up at multiple sites is a lot. So, all right, we are going to keep going, but if there are questions about any of these signups, feel free to put them in the chat and we will come back to them later. So now we're going to talk through a little bit more about the vaccines.
So you've already heard, I'm sure, that Johnson & Johnson also now has an EUA. And there's some really super positive things about it. So this slide shows you what's in it and why they're in it. And it's a lot of words that are more than one syllable, but those are very basic components that are in vaccines. So there needs to be the buffers, the stabilizers, the salts, in addition to the active ingredients to preserve it and to have it work the best it can in your body. It's done a little bit differently than Pfizer and Moderna because they got an old cold virus. I don't mean it's going to be negative for you, but rather that it's a very weak cold virus that won't give you a cold, and made it added the COVID spike protein in it. So that is what you're getting, and that's what your body responds to in alarm and provides the immune response. So some of the really great things about Johnson & Johnson is that it's one shot only. If you have someone you know who needs to be held down, I mean, literally, I've worked with people who needed 3 people to hold them down to have an injection because of their severe response, reaction, and fear. If you know someone who has that kind of a response, it may be wise to wait until they can have Johnson & Johnson. For any of the rest of you, I would say whichever vaccine you are offered, take it. The negative you've probably heard about Johnson & Johnson is that it doesn't have a 95% effective immunization against any effects of a COVID virus. However, it does have an 85% prevention of severe COVID symptoms. And it has a 100% prevention of hospitalizations and death from COVID. So that's the big deal. That's a super big deal. Furthermore, those test numbers that came back in the 66% worldwide, 72% US, are a little misleading because there are variants that are a little more potent, as difficult to treat with the vaccines, and they still were able to be effective with those variants. So Pfizer and Moderna, they're still effective with all the variants, and we'll get to talking about variants later, but probably not at the 95% level. So another positive about the Johnson & Johnson is it doesn't need to be frozen. It can be kept in a refrigerator for a long time. So that really makes it so much easier to handle it and to make sure there are no wasted doses, to make sure it can go out to many pharmacies and other places where it might be more difficult to maintain the standard of keeping something frozen. And so really it's a huge thrill. And I just gotta say, I'm so proud of our government working together with private industry. They worked with Merck, which is a competitor of Johnson & Johnson. And Merck had started on their own vaccine, but it didn't work out. They have now agreed that 2 of their factories are going to work on making Johnson & Johnson vaccine. So really highly increasing the number of doses of Johnson & Johnson that are going to be distributed. You may have seen a headline from Biden that based on all of this information, he's now saying by the end of May, every adult who wants the vaccine will be able to have it. So that is by far the most positive news that we've heard yet. And I think him being a politician, he's probably not going to make that promise and then have it hit him in the face. I think that we can feel pretty positive that you all will be able to have the vaccine. I'm thinking by the end of March, that's the push, that all the teachers are going to be done, completed. And I think we're at 65% of the elderly. We're getting up there anyways. So I'm really hopeful that in April, there should be no issue. Oh, I have 68% of the elderly actually. So that's even better.
One thing about that end of May
Mhm.
timeline that the president mentioned, one thing I interpreted it one way, and I talked to somebody else who interpreted it differently. But it was like end of May, all of those doses would have been produced, but that doesn't mean they would have been put into people's arms and people would be fully immunized or fully safe from the virus at the end of May, that whole process still might take
Interesting.
time.
So I would have to go back and read, and I didn't hear him say it either. So it's what is presented in the media.
Mm-hmm.
I think it's at least everybody's getting the first dose. It may not be complete. And we will talk about that. When are you completely safe or very safe against COVID? It's not the minute you have your shot, and it's not the minute you have your second shot either.
Mm-hmm.
So
we go into that before.
Yes, I think it's important for people to realize that it's a process of time. So with Pfizer, you have your second shot after 3 weeks. And then 2 weeks after that, you should be in the clear. You should be like 95% free of the possibility of having any symptoms. So Moderna, 4 weeks between the 2 shots, and then also 2 weeks after the second shot. So that's what I had. So I'm counting the days after I get my second shot until I feel we are safe. We can be comfortable, not worrying. Johnson & Johnson's a little different. It's only one shot, so you're ahead with that. But it's 28 days after that shot before you have reached your highest immunization, you're immune as much as possible. And we've talked about the statistics of that already. You might get a little bit sick with COVID. You wouldn't get terribly sick. So you have to count that in. You don't want to jump the gun and make plans to do something immediately after getting your vaccinations. You want to just plan for it. Put it on your calendar. That's what I did. The other thing I want to really emphasize, and this is after I get vaccinated, so maybe that's the next category, that you want to be very careful that you keep your vaccination card, because that is going to be very likely to be super important. You get it filled out, and then they fill out the next line when you get your second dose for Pfizer and Moderna. And then you should keep that with you. I just was communicating with my sister, and she said they took and got him laminated. And they're carrying them in their wallets just as if like with their driver's license. It's up to you, but whoever is the best keeper of the card should be the one that keeps the card. And it may well be that if you want to take a flight somewhere, that showing them the card will be important, or maybe to attend a day program or to go back to work. It may be very important that they know that you've been vaccinated. So will you be able to go back to work? Well, depends if it's open. And we have got some good news from Dane County. Health Order number 14, effective March 10th, is going to open things up quite a bit more. So gatherings, restaurants, even bars are going to be open more. So if any of those places are workplaces for people or yourself, you want to be checking to see if now there is going to be a spot for you to work. You will still need to wear masks, still need to use social distancing, still need to be careful, because frankly, not everybody there has been immunized, and so that's going to be the standard. That's just going to be the requirement. We can expect that's going to continue for a while, and we'll go over the timeline slide after a bit. So what do? You look at the people who have been immunized and have gone past that wait date after the vaccinations. The people that are safe, if all of your family has had that process done, you can meet with them. You can be with them without wearing a mask in your homes. You can even give them hugs. It will be safe. If you and another family or some other friends, the thing is, you want to make sure that you've all had the vaccinations and you've all gone past the wait date. So that's hopeful, though. That gives you an idea of little bits of normality, I guess I would say. So we know that by summer, adults, or we hope, now they're saying May. I would say, if the person you talked with was saying, oh, that's not really truly having immunity, then we look at this timeline and we can see probably summer then would be accurate. You can see in spring, that's where we're talking about spring, small gatherings of vaccinated people might be possible. You'll also see, and we're going to get to the variants, we will closely monitor for variant-driven surge. Then summer, a combination of widespread vaccinations and warmer weather, remember that does help, would likely make many activities much safer. And you may be able to ease up on mask wearing and social distancing. So that's really our hope. And by fall, most of the population should be vaccinated. Things should feel more normal. Hopefully, a regular Halloween, a regular Thanksgiving. Wouldn't that be lovely? Um, and Christmas with
You're making dreams come true here, Marcia.
yeah, well, with the with the warnings, and we'll get there too. But you'll see, and it's good that it is included. There could be a possible resurgence in colder months. Now, hopefully, we're talking about some, not pandemic, but some, and there could be a need for booster shots. So I want to talk about extra shots, not only for a booster shot for the original virus that we're familiar with, but also for the variants. So it was absolutely astounding how rapidly these vaccines were able to be made. And already, right now, they're looking at the variants. The most contagious one that's pretty much everywhere, at least in part, in our United States and also in Wisconsin, is the one that comes from the UK. It doesn't seem to be that different, as in the vaccine should be equally effective for it. However, it is more contagious. That's the biggest thing. And so, they're warning about that. If people don't get the vaccine, then that contagious variety can become real prevalent and cause more people to get sick. The one from South Africa is the one that people are the most concerned about right now, because it has enough changes on it that the vaccines have to work harder. They still work, but they don't work quite as well, at least in the lab when they put them two together. And so Pfizer and Moderna are already looking towards making another vaccine that is more specific to the changes in the variant of the virus. And they don't have to go through the whole process even. They can go right to phase 3, which is testing on real live people. About 10,000 people is what they're saying right now. Now, this hasn't happened yet, but that's what they're saying, which wouldn't take nearly as long as the relatively short process previously. So the other thing with the variants is there's just an awful lot we don't know. The only way we can know exactly what the virus is if people who've gotten the virus are tested, and they get the virus from the lab work that's done and do genomic sequencing. And that's the complicated stuff that they do to look at exactly what it's made of and any changes. And there just isn't very much of that genomic sequencing done. We in Dane County have 2 labs that do it because of the university. But even here, 5 to 10% of the viruses are being checked, and across the nation, about 1% from the most recent information I have. So we really don't know. We should presume, and that's the other thing I want to normalize. It's normal for a virus to mutate, to change. That's why you have a different flu shot every year. They change the flu shot to fit the new kinds of influenza virus. And so it isn't like this is super like science fiction scary. And the expectation is that there will be some variants of this virus around for a long time. That it's going to be like other um, COVID viruses and be like a cold or something that's relatively minor, maybe a frustrating thing to have. But we don't know. That's all conjecture at this point. It's like, well, you know, we'll see. But what we do know is you want to get the vaccinations. And even though you're going to have, and I'm looking and planning for it for myself, probably some immunization side effects after, especially after the second dose, that it will be well worth it. And so I think we've talked about it before. You've probably read it too. They'll maybe have a sore arm. You might also feel achy, kind of under the weather, fatigued, headache, maybe even a low grade fever and some chills for a day or two. And yay, you really do want to think, yay, I know my body is fighting this. It knows it's something that it needs to be watchful for here on out. And so if I'm exposed to the COVID virus, it's gonna tackle it and I'm not gonna get sick. So it is okay. This is one of those things where if you feel lousy a little bit after your second shot, it's all right. I haven't heard much about the Johnson and Johnson, but you could expect that very likely there would be immune side effects with it as well. Um, and it's your body. It's your body saying this is something we have to fight, and that's a good thing. You want that to happen.
Marcia, one thing we forgot to talk about back when we were talking about kind of what to expect after getting vaccinated and being fully immune or fully immunized. We didn't talk about, whether last time I think we had you, we were talking about whether or not a person who's been vaccinated and is fully immunized can still spread COVID. Do you want to talk a little bit about what we're learning about that?
Yes, so we do not have any good research data as yet. Probably the most information we have is from Israel because then that's Pfizer primarily. 600,000 people that had the Pfizer vaccine. They were really amazed at the screeching halt to the virus. So from that and from other anecdotal evidence, it seems very unlikely that you're going to be carrying the virus to other people and making them sick. But we don't have that as a given. The other thing that they're doing more testing on is it really seems clear that the amount of virus you're exposed to makes a difference in how likely you are to get sick. That's why masks help because that prevents very much of the virus getting out. That's why distancing helps. That's why minimizing amount of time with somebody helps. Those all limit the amount of virus exposure. So it stands to reason then that if you've had the vaccine and then you've been exposed to the virus and you get a little bit of the virus in you, it's going to be such a small amount and you're not going to be coughing, you're not going to be, um, acting sick. So the minimal amount you have is probably not going to be much of a factor for sharing. But this is theoretical. This is not proven in data. And it's kind of, we don't have people that are lab rats in a giant lab rat place so we can check this out. But it definitely does seem like that is the case. Again, though, I do want to encourage that you still should wear masks when you're out in public. And mostly that's going to be required for a long time anyway. but I don't want you to feel freaked out like I'm going to make everybody sick.
Mhm.
I think you can feel comfortable that you are doing a good thing. You've gotten vaccinated. You're still going to wear the mask in public, um, not outside. You don't have to wear a mask outside unless you're in a big group altogether. And they are opening it up so people can be outdoors in larger groups, outdoor gatherings of up to 150 people, starting March 10th in Dane County. Well, then yes, you want to wear a mask. Um, and you're going to want to do some social distancing because that's a lot of people. But in general, it's positive news.
Mhm.
We want you to understand it's really well worthwhile to get the vaccine.
Thank you, Marcia, for that. Let's go to the slide. Just for those of you who have children in your life or who are working with children, I think this is just really helpful to see the timeline for when the shots are going to be available to people under 18.
Right. So Pfizer can do 16 and up now, but then they're doing the testing now. Well, they said October. So yeah, no, they started doing the testing in October. So when did they get the results? Very soon, it says. Okay. I actually didn't pay this much attention. Expand their labels. Oh, okay. That's where I got the fall of this fall. They hope to expand to this age group by summer or fall of this year. So that's ages 12 to 15. Um, the reason we want to get the teenagers, they're more likely to actually have symptoms and spread the virus than the little children. This virus stands everything on its head. I mean, it's not typical that children are the ones that stay well and are not a worry. And we're glad they're not a worry. Um, but that's a given that kids under age 12 it's just going to be a while. Um, Unlikely to be available until late 2021 or early 2022, and I think that's pretty accurate. This website or this site, actually it's on Facebook that I access it, is a really super good unbiased science podcast. It's called um, Source of Information. I like the slides they put up. They're extremely professional. There's no political bias of any type, and they're keeping their eyes and ears open to changes along the way. So if you're antiquated enough to still have Facebook, as Stephanie told me, uh, that's really for old people. But anyways, they are they are a good source.
You could also probably listen to the podcast
Sure,
itself.
absolutely. Yeah.
Which Marcia, do you listen to the podcast?
I don't have any patience to listen to things. I don't know when I would do it because, well, maybe if I was peeling carrots or something, I don't know.
You were peeling carrots. Well, anyway, I'm sure it's a good podcast because all of their graphics are beautiful
Yeah.
and very, very clear and easy to understand.
Mhm.
So,
Yeah.
yeah. So anyway, I distracted us from talking a little bit more about the variants. So I'm going to go back to that slide. I think, Marcia, one thing we talked about the other day was kind of along with the booster shot,
Mhm.
immunity for people who've experienced COVID
Oh, yes.
was one of the topics we were going to cover.
Right. And it's been very interesting. And again, we don't have any like hard data research papers that have been published, but um, they've been doing lab tests on people who've had COVID and checking on their white blood cells and their memory cells for immunity, um, and finding that it lasts at least 90 days and it's looking longer. Then I saw 4 months, and now there's some possibilities it lasts up to 6 months. They also have found when they've had people so right now they're saying don't get the vaccination, if you've had COVID, not until at least 90 days after your symptoms have ended. So some people now are getting a vaccination, and they are checking their labs. And even after that first dose, they're having a very strong response. So it seems like it builds on the immunity that was partially developed because of having had the virus. And even though it's been after 90 days, it's still there, probably at least in the memory cells. So that is very positive. Somebody yesterday asked me, um, I did one in Appleton, and they said, well, if you've had the virus, would you be likely not to get the immunization side effects? And I said, no, you're more likely to get the immunization side effects because you're building it on the immunity you already had developed, on the cells that were fighter cells that were developed when you got COVID-19. So, however, I want to caution, I know this has been up in the air across the world. Should people get the 2 shots? And right now in the US, we're definitely saying everybody should get their first and second Pfizer or Moderna shot. What we don't know is if that might change, especially for people who've had the COVID-19 themselves. And so again, it's one of those things you kind of need to keep an eye and an ear out, because we're learning as we go along. But it's really good information to know that the immunity, the antibodies that you have developed, stay strong for longer than what they were worried about at the beginning.
All right. So to sum up in a few words, mostly good news, but we need to keep an eye on the variants is kind of the message for today. Would you say?
I definitely would say that. There's been one other thing that's been in the news. If if the variants are so much more contagious, should you wear 2 masks?
Mm.
Well, I think for many people that is just too much. I guess, you know, it certainly would be fine if you wanted to. So what they're talking about is a paper mask, a surgical mask, along with a cloth mask over it to help snug it tighter. So if somebody can handle that and they want to do that, go for it. I mean, it's not going to harm you. It might make you feel a little more claustrophobic. Um, so I'm really not pushing and promoting that at this point. I guess if the variants really surge the problem, then it may be necessary to take that step. That's really kind of how I feel about that. It's far more important to put your energy into getting the vaccinations at this point than to be worrying about how many masks to wear.
Sure. And that the double mask, that's related to just the fact that some of these variants have evolved to be much more contagious.
Yes, exactly.
Yeah.
One other thing I'm mentioning to people, because I don't want anybody to have undue alarm, they have found that women who have a mammogram after having had their vaccinations may have enlarged lymph nodes that set off all kinds of worries about breast cancer. And so you don't need to worry if your lymph nodes are swollen, but you want to wait. That's just an immune response. You want to wait 4 weeks after a vaccination, after the second vaccination, before you would have a mammogram. And some woman yesterday, she said she argued with her doctor. He said, no, it's only 2 weeks. Well, he was thinking about when she would have a high immune status, but he wasn't aware. And that's why I want to make sure everybody is aware that wait 4 weeks after if you're going to have a mammogram, so that you don't get any scary alerts and and worries about that. They may also start asking, I would hope, at the mammogram clinics.
That's really great to know, Marcia, because literally, so I got my first dose 10 days ago, and this lymph node right here is very swollen right now. And that's the side that I got the shot in. So
immune response, yay.
Yes. So I did already message my doctor and say, am I dying? And they said no. So that cleared that up for me. But
very good.
I want to give everybody an opportunity to either put questions into the chat, or if you'd like to unmute yourself. I see Yasmin shared in the chat that she got both of her doses and did not have any side effects. So
you were
thank you. Thank you. Yes. Good way to go, Yasmin. You are a lucky lady. Okay, so Alyssa typed into the chat a question about at your COVID vaccination, they've asked if you've had any other vaccinations recently.
Yes.
And what happens if you have multiple vaccines close to
right. So I'm trying to remember, did we not do that slide? Oh, I should have. That was BPDD. I did the slide. I have a slide that gives what reasons you should not get the vaccine. And one of those is if you've had another kind of vaccine within the last 14 days. So you do not want to get your COVID vaccine if you've had a flu shot or a tetanus shot or measles, you name it, if you've had any other vaccine in the last 14 days. Also, they want to make sure that you're feeling well. So it's just like with the flu. They always say, you can't have your flu shot if you're feeling sick. And it is the same way with the COVID vaccine. If you are severely allergic, or if you had an anaphylactic response to the first shot, they don't want you getting the second one. That makes sense, right? If you are severely allergic to one of the ingredients of any of the vaccines, they want you to not have it. Of course, if you're under 16, what were some of the others? There really aren't, so very many. If you have some kind of challenge with different kinds of, like if you've had a kidney transplant, or if you had any of those kinds of things, or you're having cancer treatment, I wouldn't say you shouldn't get a shot, but you need to check with your doctors that it's okay. And the same way for women who are pregnant or think they might be pregnant, check with your doctor, because they weren't tested on people who were pregnant, not knowingly anyways. But I know a number of doctors, obstetricians, have said they feel it's safer for the person to have the vaccine than it is to possibly get COVID. So again, with any of those kinds of like question mark conditions, check with your doctor. On the other hand, and this was a new study that just came out today, people who are obese are much higher risk across the world, much higher risk. That's data from, I don't know, many, many thousands of people that they've, worked it out. So, and people with diabetes, which kind of goes, it goes along with being obese if you have type 2 diabetes. So there definitely are things that put you more at risk. And, we have lots of individuals we work with who have developmental disabilities that also have coexisting conditions. So more reason. If you still need another reason to get your shots, there they are.
Yeah. Thanks, Marcia. That clarifies it. I think, and mostly I think important to check with your doctor if you're not
Mhm.
sure.
Yes,
Right?
if you're unsure,
Yeah.
if you should have it. Yep, check.
Yep.
Yep.
Okay. Are there other questions for Marcia? I'll give everybody a minute if in case someone's typing it into the chat, but
Stephanie, do you want me to send you that slide then about
that would be
waiting?
great.
What you
Yeah.
should wait when, who should wait to have their vaccination? Yeah,
Yeah, that
because
would
that
be.
would still be updated. I mean, that's still current.
Mhm.
That's another one from the unbiased
Nice.
science.
Oh, okay. Okay. Yeah. Any information is always really helpful. And I know for folks who are still trying to figure out how to sign up for the vaccine in their own community, right? Anywhere in Wisconsin, you should be able to access a Walgreens or a Kroger Pick and Save Metro Market store that will be able to put you on their list. It's hard to say how quickly you might get selected to get vaccinated because that depends on a number of factors. But one thing that in kind of looking at the Walgreens website, and I think this is true for the Alliant Energy Center website, is that every 3 days they offer 3 more days worth of appointments because they don't want to schedule 2 or 3 weeks out necessarily at those sites because of just the unfortunate nature of the vaccine supply right now is that it's still not predictable week to week. And so even if it might, when I looked at the Walgreens yesterday, it's and put in my zip code, it said there are no vaccines in a in the next 3 days at that zip code. And so one, you can put in multiple zip codes. And if you're, in an area where maybe you'd be able to travel easily to a different zip code, certainly in Madison, there's quite a few different zip codes you could put in that would all be the Madison area, but just, you know, those kind of things I think are helpful tips that we've heard from other people. Supply in Dane County seems to be pretty limited in those vaccine pharmacy programs. I know a lot of people have been successful at going to adjacent counties and looking at pharmacies there. So that's another thing that's been successful. My brother very fortunately got his first dose last Friday because we got a tip on a Walgreens that had a few doses expiring. And so my brother and a friend were able to get in touch with the pharmacist and got permission, to come over and get vaccinated. So there's a lot of different ways I think that people are getting access to it. And at Love Inc., I've been in touch with one of the health providers in town that's been providing vaccine clinics to people who aren't on their health insurance to see if they would want to do a vaccination clinic with us, just in the hopes that we can continue to make it more accessible to people, in particular, folks who don't have the time or the bandwidth to chase the vaccination opportunities. So
The other thing we forgot to mention is on the DHS website, so dhswisconsin.gov, they do have an interactive map of the whole of the state of Wisconsin. And so you can click on it for the area you're at or adjacent to where you're at, and it'll come up with the different vaccinators. That doesn't say if they have availability, I don't think. But it at least gives you some other ideas if in case you're coming up a blank and you think, well, what about the adjacent, what about Columbia County or whatever, Columbus County? So anyway, yeah, so that's another thing you could check on.
no, that's a good point, Marcia. Yeah, if you can search by county on that vaccine map, and it'll give you a list of pharmacies or vaccination sites for that county. Yeah, not all of them have vaccine every week, but it's worth a shot. Oh,
Yeah.
I see another one of our young adults, Lauren, says she got her first shot today. Hope you're feeling good, Lauren, after your shot. Keep moving that arm around.
Yes.
Do big arm swings. That's
In
what I was
fact,
doing.
myself, I always do I'm right-handed, and I always ask to have any vaccination in my right arm because I use it so much more. It doesn't get as stiff and sore as if I have it in my left arm. So,
Sure,
yeah.
sure. Yeah.
They're talking about more group clinics across the state to large group. I think then they're going to pull in people to help that, that they can run them through faster. So that's like they said in the next 2 months. So we have to keep looking.
Right. Maybe that's more when it becomes generally available.
That might be. Yeah.
Yeah. Yasmin did ask, is there a third shot? Are there side effects for the third shot? So I think that's, this booster that's potentially
Oh,
going to be.
yes. So we really don't have any idea yet. I mean, what I would guess, if there is going to be a booster shot, it's going to be long after when you've had the first. So it might be, a year after your first 2 shots. And so typically, like with your flu shot, you get a little arm soreness. But we really don't know. I would expect there's always the possibility of immune side effects because you're amping up your immune system again to fight the virus. But we just have to wait and see on that one.
Yeah. Stay tuned, Yasmin. All right. Well, Marcia, thank you so much for being so generous with your time and taking the time to answer questions for us about the vaccine and about COVID in general. Very much appreciate you always. And glad that you got your vaccine because you need it. And we just really appreciate all of this. We are going to be posting this on YouTube. So for folks who couldn't be here, this will be available to watch later. So hello to those of you who are watching this as a recording. But again, just thank you very much, Marcia. We appreciate you.
Glad to do it. And I really, the more we all share accurate information and encouragement for people to be patient, but then to be ready and get the shots, the sooner we can have normality again. And I think we all want that.
Who knew we would all be so desperate for normal?
Yes, for sure.
Well, thank you, everybody. Good to see you all.
Bye.
Well.